Can knee arthritis heal without surgery? Is there a way that you can prevent undergoing the knife and still improve your condition without seeing an orthopedic surgeon? I'm Dr. Paul Lieber from Regenexx Pittsburgh. I am a non-operative orthopedic interventionalist. I don't do surgery, but I do treatment with needles and your stem cells and platelets to help you heal. Let's dive into knee osteoarthritis. It's a very common condition. It affects most adults. It's the most common area that we treat by far and away. Arthritis in the knee can be debilitating. It can affect your ability to move by virtue of knee stiffness and pain, and this can then affect your overall life. Because if you don't have mobility, you can't walk without being in pain, your activities will be limited and your function overall will be limited. Knee arthritis is an inflammatory condition affecting the cartilage in your knee. As we age, we have what are called inflammatory cytokines that cause the breakdown of cartilage over the course of time. So if you're wondering what happens to knee arthritis over the course of time if left untreated, what the typical course that the inflammation, pain, stiffness, lack of mobility will continue to increase and get worse to the point where you may require an artificial knee replacement in order to restore your function. We at Regenexx Pittsburgh think that we have a better way of dealing with knee arthritis to prevent that from occurring. So another question is, can your knee heal without surgery? And surgery really is not a way to heal a knee condition because you're removing cartilage by scraping or debriding it or giving you a total knee replacement. What we can do with your own stem cells and blood platelets is reduce the arthritis frequency and reduce the amount of inflammation that's occurring by changing the inflammatory cascade to reduce the breaking down of cartilage and help rebuild cartilage and restore the balance that the body has in the inside of your knee. So we can do this by two means. One is by using your platelet-rich plasma or using bone marrow concentrate, which we get from your posterior pelvis in your bone marrow. And platelet-rich plasma can be used for mild osteoarthritis. It contains growth factors that help attract cells to perform repair inside the knee joint. We can also use platelet-rich plasma to heal ligaments and tendons that may be impaired in the process of your developing knee arthritis. We do this by precise guidance with either ultrasound or X-ray to guide the needle to the area that is injured, and as such, the results can be better than if these orthobiologics, the platelet-rich plasma and the stem cells, are injected without guidance. The stem cells that are gotten from your bone marrow concentrate are for moderate to severe osteoarthritis. They can be put into the joint on the surface of the joint, and they can actually become the cells that they're put onto. For instance, they can become cartilage cells, bone cells, tendon cells, or ligament cells. In addition to that, in severe arthritis in the knee joint, we also put cells into the actual bone. This fortifies the bone from the inside out and appears to be a very effective way in preventing people from undergoing knee replacement surgery. Even with bone-on-bone osteoarthritis, you have a good chance of doing very well with using your own stem cells from your bone marrow concentrate to create a repair. And this can last for years and years. There is literature that shows that 87% of patients who were told that they needed a knee joint replacement, if they underwent treatment with their own stem cells from their bone marrow concentrate, were able to avoid knee replacement several years out. You're probably wondering whether insurance pays for these treatments. And the short answer is no. The insurance pays for your evaluation with the physician, myself included, and it pays for the therapy, the diagnostic studies, the bracing that you may require for a short duration following a knee treatment. Interestingly and importantly, if you undergo treatment with an injected orthobiologic such as your platelet-rich plasma or your stem cells from your bone marrow concentrate, the recovery is within a few days, as opposed to a joint replacement where they're amputating your knee joint, where the recovery may be 2 to 3 months. That's a lot of downtime and a lot of time away from work. So with co-pays, deductibles, and time away from work, you may actually be saving money when you undergo a regenerative treatment with your own orthobiologics. Additionally, Regenexx is the biggest provider of stem cell and PRP, or super concentrated platelet treatments in the world. And we do have over 2,000 self-insured employers that provide this treatment to their employees for a reduced cost or for free. The good thing is that you're able to come in to have an evaluation with a physician, not a physician extender, and spend about an hour with that physician going over your history, doing a physical exam, reviewing your diagnostic studies, and doing an ultrasound examination of your knee. We'll come up with an individualized treatment plan for you, and we have payment plan options to make this more affordable for you. If you're interested in finding out whether you're a candidate for this treatment, you can email us at regenexxpittsburgh.com and find out. You can also contact Sarah Matthey at Regenexx Pittsburgh 412-963-6480 and have either a video teleconference evaluation or an in-person evaluation that's usually covered by your insurance. In conclusion, knee osteoarthritis can have a profound effect on your overall health, mobility, function, enjoyment of life, and also your need to take pain medicine or medicine to treat osteoarthritis, which has a high potential to form ulcers in your stomach and affect your kidneys and liver. We at Regenexx Pittsburgh are all board certified in physical medicine and rehabilitation and have a subspecialty in interventional orthobiologics. We can make the diagnosis to help you find a way to get better, to improve your function overall, get you out of pain, and enable you to enjoy life, find it much more fulfilling. And we do this every day.